Patricia Simone, and today I'm going to be doing my IV fluid administration video for BSN 266. Today I have my gloves, I have my alcohol wipes, I have my primary administration tube, my secondary administration tube, I have my amoxicillin, I have my nasal saline, I have my trash can, I have my calculations of my provider's orders. I'm going to bring this closer to the screen. So first order is nasal saline of 150 milliliters over an hour. So my calculations is 150 milliliters times 15 drops per 60 minutes. That comes out to 37.5 drops per minute. So because we cannot give half a drop, we're going to round up to 38 drops per minute. So that's our answer. And then our second provider order is a 250 milligrams IV of amoxicillin in 100 milliliter nasal saline over 15 minutes. So my calculations is 100 milliliters times 15 drops over 15 minutes equals 100 drops per minute. And this is what I'm going to be doing, basing our procedure off of. So first, before I go into the room and gather my supplies, I'm going to make sure I have the 6 rights of the medication administration. So I have right patient, right drug, right dose, right time, right route, and right documentation. I'm going to gather all my stuff, and I'm going to knock on the patient's door. And I'm going to close the door behind me to provide patient privacy. I'm going to introduce myself to the patient. Hello, my name is Simone, and today I'll be your nurse. Your doctor has ordered you some nasal saline and some amoxicillin for your infection. It's an antibiotic. Are you allergic to any medications? No? Okay, great. Can we get started on this? Is that okay? Do you have any questions? No. So I'm going to first wash my hands and put on my gloves. Okay, and I'm going to explain the IV administration set. So the tip here, this should remain sterile. This is the spike in, so this is going to go into the medication. And then we have our drip chamber. We're going to be able to see our flow rate in here and make sure that there's no air bubbles. And then we have our roller clamp. And this, we're going to be able to adjust and control the flow rate by stopping it or slowing it down or speeding it up. And then, excuse me. And then right here, it's a Y site. So right here, this is where the medication is going to go through from the secondary tube. This is going to be cleaned, and you want to make sure that the medication is compatible so that the tubes are compatible. And then this adapter in, this is going to be going to the patient's IV sites. So I'm just going to place that right here until we're ready to use it. And then our secondary tube works very similar to that, to the primary tube. So the top part is the spike end, and that's going to go into the medication. Then we have the chamber. We're going to be able to see our flow rate and make sure there's no air bubbles. And then our clip, we're going to be able to adjust our flow rate. And then this end part is going to be cleaned, and this is going to go into the secondary tube. So before we get started again, we're just going to do 6 right of medication again to make sure that we are not having any errors or have any, make sure we're maintaining patient safety. We want to make sure we have the right patient, right dose, right time, right route, right drug, and right documentation, and make sure that the patient is not allergic to anything, the patient is not allergic to anything. So we're going to spike the nasal saline first, and we're going to hang that up first. And we're going to make sure we adjust it to 38 drops per minute, just like we did with our calculations from the healthcare provider's orders. So I'm going to take the tip off. Oh, no, not yet. I'm going to take the red part off of the nasal saline. So this part would be if we were adding medication, but we're not. And I'm going to take the tip off the spike, and I'm going to prime it and make sure that it's in all the way. Perfect. And I'm going to hang this IV fluid up. I'm going to make sure these drips are right here. Make sure it goes out so I don't get any water. And I'm going to make sure it is adjusted for 38 drops per minute. I'm going to do this. Perfect. By timing for a minute, and I'm going to start timing now. Okay. Now that is done for a minute, so it is at 38 drops per minute. I am then going to make sure that I have the amoxicillin. Again, I'm going to make sure the patient knows that this is amoxicillin. Make sure that they're not allergic to anything. Going to do the right patient, right dose, right time, right route, right drug, and right documentation. Patient denies that they're allergic to amoxicillin. So great. So we're going to prime this. So then we want to make sure that this is 30 inches above the IV site. So we're going to take this primary bag and we're going to bring it down. We're going to clip it to the bottom. We're going to take the secondary and make sure that the secondary is above the primary site, because that's the medication that the provider ordered. Perfect. And we're going to take our alcohol swab. And we're going to take the top off. We're going to clean this. Let it dry. About 20 seconds, letting it dry. And the other side, 20 seconds. And then we're going to attach the primary and secondary together. separate. And we're gonna make sure that the amoxicillin is at 100 drops per minute. Double checking the healthcare provider's order. And I'm just gonna verbally say that it is and not do the time like I did the nasal saline. Then we're gonna check the IV site and make sure that it's not red. We're gonna ask the patient if they have any questions or need anything. We're gonna let them sit and we're gonna remove our gloves, clean our mess, and provide hand hygiene, and that is it.